Hello, and welcome to Educate Me MD. I am Dr. Sarah Soltz, and I've been working as a general pediatrician for over 10 years, and I'm very excited to begin this journey today. There's so much pain and anxiety in our world, and I believe a lot of it is caused by lack of education about the best way to care for ourselves and others. I'm passionate about education and hope this can be my small contribution to making the world a better place. So if you agree, then here we go. Let's start at the very beginning. Let's start this series with a newborn. I love kids of all ages, but newborns and infants hold a special place in my heart. They're so small and helpless, yet they change so quickly, and parents have so many important decisions to make in the first year. So let's begin with a story. In medicine, we call them case reports. Imagine a healthy 25-year-old woman who has had an uneventful pregnancy and delivers a healthy baby girl on her due date. I'm not an obstetrician, so I'm not going to discuss pregnancy and labor issues, but assume that all went well. Ideally, if this baby girl is breathing well, she'll be immediately brought to her mom's belly or chest, depending on the length of her umbilical cord, for skin to skin. After a minute or so, the umbilical cord will stop pulsing and can be cut, and then the baby has more freedom to move while the placenta is being delivered. Skin to skin has been shown to have multiple benefits for mom and baby, as well as dad and baby, including bonding, temperature control, and can decrease pain for both mom and baby, and gives this new baby girl a natural opportunity to root and feed. So feel free to do it often in the days after birth. One of the first things a newborn wants to do is eat. So let's talk about nutrition for a minute. Let's say this baby is about 7 pounds, which means she's not too big, large for gestational age, or too small, small for gestational age. There is a chart that's usually posted in most delivery rooms that doctors use to determine if the size is appropriate, because if a baby falls at either extreme, then they're at increased risk of problems with their blood sugar and temperature. And so it's common to check the temperature and blood sugar more frequently in those babies. A temperature that's too high or too low could indicate that there's a problem, as well as with the blood sugar. It can be either too high, which would be over 150 at this point, or if it's lower than about 40, they may need to check it again more frequently. Usually, the blood sugar is checked with a small prick of the heel, and then a drop of blood is tested in a small handheld device called a glucometer. And even if it drops as low as 25 to 30, the usual course is just to try feeding again and give it some more time to come up. But if it does get too low, the normal body functions can't happen well, and baby may not feed well or could even have a seizure. So it is important that we keep a close eye on that. And even at a normal size baby, if they're having issues, then often we'll check blood sugar, also called a glucose, to see where it's at. So babies in the first 24 to 48 hours are allowed to have those low levels of 25 to 30, but quickly it should normalize to adult level, which is 60 to 100, assuming that everything else is going well. Okay, sorry for the aside, but back to feeding. You may have heard the phrase breast is best, and if at all possible, mother's milk is the best nutrition because it's tailor-made in the same body that just grew the baby. Some reasons a mom may not be able to nurse is if she's had surgery on her chest, if she has certain infections such as HIV, or if she's undergoing certain treatments such as radiation or chemotherapy. But there are always exceptions to these things as well, and luckily those are not the situation for a majority of women. If breastfeeding is not possible, then formula can be offered, and I usually recommend to start with a standard newborn formula because they're often the closest match to breast milk. That being said, even the composition between Breast milk in different women can vary a lot. So I may do another whole episode on formulas because there's a lot of options and nuances between different brands and ingredients, but overall there's a lot of quality control around all of the brands, so all of the American and European brands should be safe. It is very important not to use regular cow's milk or goat's milk because a newborn's gut cannot process this yet, and that could lead to anemia and malnutrition. So regardless of the type of milk used, a newborn only needs about 5 mLs for their first feed. This is 1 teaspoon and a tiny amount. Their stomachs are only as big as a marble or a cherry at birth, and then they grow quickly to the size of a walnut or so by about day 3, and then they'll need about 25 to 30 mLs of feed every 2 to 3 hours. And 30 mLs is 1 ounce or 2 tablespoons. So again, not a huge amount, but it is important that they're being given something with regularity. So if a baby's going longer than 4 hours and not wanting to eat or not taking at least a little bit, then that is concerning and a reason to look into it further. So the best way to monitor if a baby is getting enough to eat is by their output. So newborns should pee, or void is the medical term, at least once in the first day and have 1 poop or stool. They'll gradually void more with a goal of 4 to 5 times a day by 3 days old and stool 1 to 10 times a day. Obviously, there's a much bigger range there. Newborn stools are called meconium, and they're a thick, black, sticky substance that can be hard to clean. And as long as the baby is eating well, this usually changes to a normal newborn stool by the time they're about 2 to 4 days old. And these are often described as yellow, seedy, and are watery. And then they don't usually change again until either the milk changes or foods are started. Okay. Let's say our little girl's been born, brought to her mom's chest, had her first feed. After this, the baby's usually taken to be weighed and measured, and about 10 years ago would have been given a bath right away in most places. This is one step that has changed significantly in recent years as there's more understanding around the topic. So babies are often born with a white, gray, kind of sticky layer covering their bodies. The name of this layer is the vernix caseosa, which literally translates to cheesy varnish. It's kind of gross, but it is an important layer that can protect and hydrate the skin so that they don't get an infection or things, which is what most people are worried about if they don't bathe them immediately after birth. So term babies may not have as much of this vernix as those born premature, but regardless of the amount, it can be rubbed into the skin or some of it's absorbed into a blanket, and the first bath can be deferred until they're about 6 to 24 hours old. Delaying the bath can help with temperature regulation because the body temperature always drops after it gets wet, whether you're a newborn or older, but that cooler temperature could make them more uncomfortable or even make somebody concerned that they might have an infection or things when it's just as a result of the bath. On the other end of that, waiting longer than 24 hours may lead to some smell because of bacteria accumulating and could also increase the risk of infection just depending on mom's vaginal microbiome, so it's not usually recommended to wait longer than that. One reason to bathe sooner than 6 hours on the front end of that would be if there was meconium just before or during the delivery. So meconium is more likely to happen before birth in babies that are born at term or past their due date, and if it's swallowed or inhaled before delivery, it can be a dangerous situation because meconium is very irritating to the lungs, and this may be one reason why a baby may need to go straight to the warmer or for care right after delivery instead of going straight to the mom's chest. So there are a lot of reasons why a baby may need to go straight to the warmer, but the most common is that they're not breathing well. I know this is a scary concern for new moms, so I wanted to talk through what normally happens, and because often moms are laying there on a delivery bed, they also can't see the baby well after birth. So if they go to the warmer, then it's kind of a mystery. So before a baby's born, their lungs are full of fluid. It's the amniotic fluid that's also around them before they're And the transition to breathing begins during labor. As the baby's squeezed through the birth canal, some of the liquid's pushed out, and certain hormones are also released that help the amniotic fluid to be reabsorbed. Then, just as the baby's delivered, they come out and take their first breath. So it makes sense that a baby may have trouble if it was either a very fast labor or delivery or a C-section, because those other steps leading up to delivery may not have happened. In these cases, the first thing we as pediatricians are taught to do if a baby comes to the warmer is warm, dry stim. So, meaning we don't give any treatments yet, but we rub them with a blanket to warm them, dry them, and stimulate them to take a breath and hopefully start crying. Because a cry is a big breath that will push a lot of air into their new lungs, and that would obviously be a good thing at this point. If after about 30 to 60 seconds of doing warm, dry stim, baby's not breathing yet, then the doctor will often put a mask on, give a few breaths, maybe just put it close by to blow some oxygen into their face, because that alone could sometimes be enough to get them going. And if it's not, then the care proceeds from there. There's a protocol if you've ever done like CPR training. There's one that's specifically for after birth in newborns called NRP, and that's Neonatal Resuscitation Program. And so it's something that all people who are going to be at a delivery usually are trained in, and how to proceed through those steps of what to do in case things aren't going perfectly. I felt like when I was pregnant that everyone wanted to tell me the scariest part of their labor or delivery story. So I don't know if that's just because I'm a pediatrician, but I wanted to remind people that a majority of time things go well. And I even had to go read some positive birth stories to help ease my anxiety. So remember to breathe, try to relax a little, and enjoy bringing a new life into this world. I think this is where we're going to stop for today, and next time we'll be talking about treatments that are usually given soon after birth, such as the erythromycin eye ointment, the vitamin K shot, and the hepatitis B vaccine. So tune in if you want to learn more about those. Thank you for listening to Educate Me MD, and I hope you learned something today, or maybe just understood it in a new way. Have a wonderful day. Quick disclaimer, this information contained in this podcast is strictly educational and should not be taken as professional medical advice. Even though I am a doctor, I am not your doctor, and you should always consult with your own healthcare team before making significant changes to your care. Thank you.